Thank you for participating in this evidence-based practice project on transformational leadership in nursing. My name is Nicole Jamfee, and I am a graduate nursing student from Kane University, located in Union, New Jersey. I'm conducting this project as partial fulfillment of my MSN program in clinical management, so I greatly appreciate you taking the time to participate in this webinar. The purpose of this webinar will be to improve nurse managers' leadership capabilities, as well as enhance the knowledge of transformational leadership. You are being asked to participate because you are a nurse manager at a home health care organization and a member of Home Care and Hospice Association of New Jersey. As you can see from the objectives, upon completion of this session, you, the participant, will be able to identify and analyze leadership styles, differentiate transactional and transformational leadership styles, employ transformational leadership style at workplace to motivate, support, and empower employees, and cultivate an organizational culture that encourages creativity and innovation in the workplace. Now, without further ado, let's get started. Would you agree that today's healthcare work environment is complex and rapidly changing? I would definitely agree, and that complexity is particularly evident in nursing. So it goes without saying that effective leadership and management practices will be essential to the success and future of our profession. Now, historically, nurse managers utilize a transactional style of leadership, which focused primarily on supervision, organization, and group performance. Transactional leadership is a style that promotes compliance by employees with a contingent reward, which is a motivation-based system used to reward employees that meet their identified goals. A management by exception approach allows managers to monitor work performance for errors or to solve a problem before it occurs. Some employees, however, would view this as micromanaging. Additionally, transactional leaders are willing to work within existing systems of an organization and accept its goals, structure, and culture. Conversely, the emerging transformational leadership theory will require nurse managers and leaders to be innovative and resourceful. So, transformational leadership is a style that engages its followers or employees, focuses on intrinsic needs, and works to change the organizational culture by implementing new ideas. Additionally, transformational leaders are required to empower and motivate staff to perform beyond the organization's expectations. So here we have a side-by-side comparison of characteristics of transactional and transformational leadership styles. The transactional leader employs a rewards and punishment system to motivate followers. There is also an emphasis on the expectations and outcomes of the employees. Transactional leaders tend to have a reactive nature and a bureaucratic style, with a focus on planning and execution. On the other hand, the transformational leader employs charisma and enthusiasm to inspire followers. There is an emphasis on the values, ideals, morals, and needs of the employees. Transformational leaders tend to have a proactive nature and a charismatic style. They also tend to focus on innovation and thinking outside of the box. So, now that you have an idea of the differences between transactional and transformational leadership, let's do a couple of exercises. So here we have leadership styles scenario number 1. Diane is employed as a clinical nurse manager at Compassionate Community Care, a 200-plus employee home care agency. Her staff are hardworking, loyal, and are committed to the success of the organization as individuals and as a team. Additionally, Diane's employee tardiness and absenteeism rates have been the lowest for 2 quarters consecutively. Which type of leadership style does Diane display and why? Let's find out. So, was your answer correct? Diane is a transformational leader. She clearly sets high expectations for her employees, but walks the talk to demonstrate the standards that she expects. To begin with, Diane regularly reminds her team members of the purpose of their work. She also knows that she's a role model for her team, so she demonstrates integrity in all of her working relationships. Kudos to Diane and her exemplary leadership. Now, please keep the phrase walks the talk in mind as I will discuss it shortly. Let's get to the next scenario. Medtrix is a leading provider of product development and integrated healthcare services. This biopharma company has recently expanded their initiatives into diabetes sales. The primary objective of the prospective sales representative will be to meet established sales goals by delivering real value to the organization's customers. The successful representative will need to demonstrate the ability to target and manage their territory strategically while operating within an assigned budget. They will also need to be a highly engaged, positive team player and show a high degree of customer focus. Which leadership style do you think will best fit the culture of metrics? Do you think it's transactional, transformational, or a blend of both styles? Let's see how you did. The leadership style that would best fit the culture of metrics and the new sales department would be a blend of both styles, and here's why. In a large organization such as metrics, it would be necessary to use more than one leadership style at different levels or departments within the company. Senior executives and middle management might find it more beneficial to use transformational leadership in certain circumstances or with different levels of staff than transactional leadership. For example, with the newly created diabetes sales department, the team would benefit from dynamic leadership that will engage and enable them to successfully manage their respective portfolios. From the production and sales perspective, however, the environment may be suitable to a transactional style, as there is a focus on meeting the expectations. From this scenario, we can gather that displaying a combination of leadership styles will be essential to the success of the manager. Which leadership style sounds most like you? Are you transactional, transformational, or a combination? Take a few minutes to think of some recent experiences at work where you've had to display a different style of leadership to make a decision or resolve a conflict. Thinking back to the questionnaire for a second, how did you perceive yourself as a leader? If you perceive yourself as a transformational leader or feel it may be beneficial to incorporate the style at your current workplace, let's explore the components. So here we have the 4 I's of transformational leadership, which are idealized influence, inspirational motivation, intellectual stimulation, and individual consideration. Idealized influence is defined as the leader's ability to serve as a role model to his or her followers. The leader essentially walks the talk and is admired by staff and colleagues. Remember the first scenario that we reviewed? Diane, the nurse manager, possesses an idealized influence over her nursing staff. Inspirational motivation describes the leader's ability to inspire and motivate followers. Individualized consideration demonstrates the leader's genuine concern for the needs and feelings of followers, which is essential to highlighting the best efforts of the individual team member. Lastly, intellectual stimulation is defined as the leader's ability to challenge his or her followers to be innovative and achieve higher levels of performance. Okay, so let's take it a step further and explore the evidence that supports transformational leadership. Dirk de Casterlet and colleagues conducted a case study of a staff on a rehabilitation unit during and following their participation in a clinical leadership project. A total of 12 nurse managers participated in the project over a course of 12 months. The goal of the project was to implement a 360-degree feedback approach, which means self, peer, and manager feedback to strengthen the leadership talents, develop new competencies, and include staff members in decision-making processes. The results of this study confirm the positive impact of transformational leadership development on the leader and the team members. Following the implementation of the project, Clinical leaders reported improvements in communication among staff and structure of the workplace environment. Additionally, the staff nurses reported enhanced autonomy, a cultivated sense of responsibility towards the patients, as well as improved clinical decision making and conflict resolution skills. The writers deemed the Clinical Leadership Project a valuable instrument for improving the work environments of nurses and ultimately the quality of care provided to the patients. Munir and colleagues investigated the impact of transformational leadership behaviors and the perceptions of work life balance, job satisfaction, and psychological well being at an elder care facility. The recruited staff consisted of nurses, nursing assistants, therapists, housekeeping, and maintenance who participated in this study. The study revealed a negative relationship between transformational leadership style and work life conflict and had a positive relationship with job satisfaction, respectively, meaning the higher the probability of employing transformational leadership style, the lower the occurrence of work life conflict and a higher occurrence of job satisfaction. The findings suggested that transformational leaders develop their staff's interests and commitment to the organization's mission through encouraging problem solving and molding behaviors by intellectual stimulation and promoting innovation in the workplace. Now that we have discussed the leadership differences and evidence that supports transformational leadership, let's take a look at a tool to measure the styles. Within the last 2 decades, both researchers and practitioners have explored the transformational and transactional leadership paradigm. Starting with psychologist Bernard Bass's theory of transformational leadership and later validated by business strategist Dr. Bruce Avolio, this leadership approach has demonstrated a positive impact on both subjective and objective performance. The multi-factor leadership questionnaire, also known as MLQ-5X form, is a 45-item questionnaire that evaluates 3 different leadership styles: transformational, transactional, and laissez-faire. Although the MLQ-5X was designed with a 360-degree feedback method, the survey allows for participants to use the leader/self form. For the purposes of this project, the leader form was used to essentially measure how you, the participant, perceive yourself with regard to specific leadership behaviors. Do you recall these 3 questions from the questionnaire? I make others feel good around me. Others have complete faith in me. Others are proud to be associated with me. These questions in particular measure the idealized influence component of leadership. Thinking back to our first scenario for a minute, do you think Diane, the nurse manager, self-rated a higher factor score for these questions? I would think so. Let's explore another exercise. Janet is employed as a clinical nurse manager at Santa Fe Home Care. Janet reports that her staff are seemingly disengaged, frequently tardy, and work independently. Additionally, Janet experiences high staff turnover, and the quality star ratings for the department are often disappointing. How can Janet employ, set, and communicate standards and goals of the organization and the unit? So here's some ideas. Janet can create an inspiring vision of the future of the department and organization as a whole. She can motivate the staff to buy into and deliver the vision. She can also manage the delivery of that vision and also build trust-based relationships with the staff. So the following phrases are directly referenced from Perfect Phrases for Managers and Supervisors. It's the 2nd edition and it is by Merrill Runyon. I thought these were great examples. Here's the first one. Here's what we are facing, and it is up to us to turn it around. I believe that we can. Another example is, if we are really committed to our values, we'll address them as a team, not individually. Here's another example for motivating a particular employee. I can see the skills you'll acquire on this task will be valuable for you throughout your career. Or, the job you will do on this will be helpful to fulfill our mission and our vision. Let's move on to the next exercise. Andrew, one of your employees, has worked in the case management department for 5 years. He is well liked, knowledgeable of the organization's mission and policies, and consistently meets the department's monthly quota. There is also no past history of performance issues that you can see from looking at past performance reviews. Nevertheless, you have observed that Tom regularly shows up late, takes longer than an hour for lunch, and often leaves work 15 to 30 minutes earlier. Take a few minutes to think about the situation and make some notes. What would you do? What would be your first step? Would you do nothing? Address the issue with the office as a whole at a meeting? Or would you address the issue directly with Andrew? The best answer would be to address the issue with Andrew directly. Although it may be uncomfortable at first, being clear with employees like Andrew of your standards for the office is important. It will ultimately establish your performance expectations as well as the quality of work that is expected. It is also important to explore with your boss and employees what are the standard expectations with regard to punctuality and attendance. Ask yourself first, what have been the past norms? How do these norms fit with your standards of performance? Address the fact that we may have been allowed in the past, and that is the past, but you are now establishing new norms for the present and future. Let's move on to one more exercise. Fatima, a home health nurse, is an observant Muslim who prays 5 times a day, with 3 of those prayers occurring during work hours. Elizabeth, the patient, has complained to you on several occasions that the time of prayer interferes with the afternoon IV med administration. What would and should you do as a nurse manager? So, offering flexible time for prayer can make the difference between keeping and losing a valued employee like Fatima. As a nurse manager, you should make an effort to accommodate Fatima and determine specific prayer times. You should also provide a quiet area, if needed, in which Fatima could pray uninterrupted. As the nurse manager, you also have the responsibility of ensuring that the workplace is free from harassment or discrimination. In retrospect, you as a nurse manager should respond proactively by investigating the concern and setting the expectation of embracing and understanding the meaning of cultural diversity, awareness, and sensitivity with staff and patients alike. With the shift from hospital to community-based care, the nurse leader's role has become more influential with expanded roles and new opportunities throughout healthcare organizations, such as care coordination, population health management, and wellness promotion. As nurses continue to use their management and leadership skills to facilitate the delivery of healthcare, nurse managers will need to create an environment that promotes accountability, efficiency, productivity, and opportunities for growth within an organization. Employees need a compelling reason to follow your lead, work collaboratively, and remain motivated. How will you cultivate a culture that encourages creativity and innovation today? Develop your transformational leadership skills today. Now, given the 4 concepts of transformational leadership, I like to think of transformational leadership skills as the 6 E's. Engage your employees and followers. Educate and explore ideas with your employees or your followers. Empower them to take on new challenges. Energize and continually motivate your staff to ultimately bring forth excellence in the workplace. Thank you so much for your participation in completing this webinar. Now I have an assignment for you. For the next 2 weeks, I would like for you to implement practices of transformational leadership on your job. Also, I would like for you to journal scenarios that take place during the next 2 weeks to explore alternative approaches, if any, to say conflict resolution, decision-making processes, etc. Finally, The pre and post survey leadership style results can be provided to you per your request to determine changes in your knowledge of the respective styles. Should you have any additional questions, please do not hesitate to contact me or my faculty advisor, Dr. Yvonne Wesley, at our email addresses provided to you in the informed consent. Have a wonderful day.